There's a bill moving through Congress right now that could cause hospitals to close in Nevada. And we know what happens when our local communities lose those sorts of institutions. People in Southern Nevada often reminisce about resources that used to be in their community, like the women's hospital that once stood on Sahara Avenue on the east side of Las Vegas. It was closed in 1994. I spoke with the coffee shop owner about tariffs, and he reminisced about his past, which included beating addiction in Las Vegas. He said he got clean at a facility that used to be in the central part of town. There also used to be a DMV near the historic West Side on Rancho and Cary Avenues. Now, in one of the most poverty-stricken areas in southern Nevada, one must travel several miles or take an hour-long transit ride to get DMV services. This also happened in Gardnerville, Sparks, and Reno due to state budget cuts in 2009. The loss of these three institutions, the Women's Hospital, the Addiction Treatment Center, and a DMV, represents what it means to shrink government supports for communities nationwide. When budgets get cut, people get hurt. That truth hasn't stopped Republicans in Congress from charging ahead with a far-reaching plan to extend President Donald Trump's tax agenda, which includes cuts for billionaires and corporations, while shrinking healthcare programs aimed at helping everyday people and those struggling to get by. Their bill includes $625 billion in cuts to Medicaid. Another $105 billion in cuts would come from the Affordable Care Act's insurance marketplaces. Trump's agenda could leave 8.7 million people without Medicaid coverage. The bill also proposes shortening the enrollment period and adding stricter income checks for Affordable Care Act coverage, leaving about 1 million fewer Americans insured through those exchanges over the next 10 years. In Nevada, advocates warn the state's strained healthcare system, which is burdened by nurse and doctor shortages, could face severe consequences. Medicaid, the largest federally funded state program, provides more than 811,000 Nevadans with health insurance, more than one-fifth of the population. Tens or maybe hundreds of thousands of those Nevadans could be at risk of losing that coverage under this bill. And if people lose their insurance, the ripple effects will hurt hospitals too. And more hospitals in Nevada could shut their doors, leaving vulnerable communities across the state with nowhere else to turn. Follow the Nevadan for more coverage of Trump's agenda.